Hi, Mrs. Jones. I just wanted to go over some information about HIV with you. As we know, the immune system is made of cells that help fight against infection. HIV, also known as human immunodeficiency virus, attacks those cells and it keeps the body from fighting infection. HIV is transmitted through blood and or semen and vaginal secretions. And if it's left untreated, it will progress to AIDS, which is also known as acquired immunodeficiency syndrome. AIDS is the late stage of HIV where the body is severely damaged and leaving a short life expectancy. Although there's no cure for HIV, there is medication treatment available to lower the amount of HIV in the blood, which will prevent the virus from progressing to AIDS. Now, there are several complications with HIV. Because it attacks the immune system, a client with HIV is prone to chronic infections. These infections can be bacterial, viral, fungal, or even protozoan. HIV patients are also prone to developing certain cancers. Another complication of HIV is something that's called wasting syndrome, which involves significant weight and muscle loss, fever, and diarrhea. Other complications include electrolyte and fluid imbalance and seizures. Excuse me. Now, in order to avoid infections, it's important to maintain good hand hygiene, avoid large crowds and people who are sick, and take your medications as prescribed. It's also important to stay hydrated, drinking 8 to 10 glasses of water, and eating foods that are low in fiber, such as bananas, rice, applesauce, and toast. That will help with diarrhea. Most importantly, it's important that a patient call the provider immediately if they are experiencing any sign of infection. Okay, now I just provided you with a lot of information about HIV. Do you have any questions? Okay, can you share with me what HIV is and what AIDS are? Great. What are some of the complications involved with HIV? Okay, and how can a patient help prevent those complications? That is correct. And finally, when should an HIV patient call their provider? That's right. It sounds like you have a great understanding of HIV and AIDS.